Hello, my name is Dr. Hal Spencer and I'm Medical Director here at Chesterfield Royal Hospital. We're trying to get medical services back on track, and staff in GP surgeries, urgent treatment centres and here at the hospital are all working really hard to provide you with the right care in the right place at the right time. But we also need your help. With our emergency department at Chesterfield Royal Hospital in very high demand and with potentially long waits to be seen, we're asking people to think about the service they really need. Common illnesses and minor injuries like coughs and colds and small cuts and grazes can be treated by you using over-the-counter medications and first aid kits. Talk to your pharmacist if you have earache, conjunctivitis or a rash. They often have a consulting area where they can discuss things in private. Other issues such as back pain might need a GP call back, or for minor injuries, our local urgent treatment centres often have waits of an hour or less. And if you're not sure where to go for your care, give NHS 111 a call first. Their team of professionals are always on hand, around the clock, to give you the help, support and advice that you need. Of course, A&E services and 999 are always available and should always be the first port of call for severe bleeding, head injuries, breathing difficulties or chest pain, so that you get immediate medical attention for something that really is life-threatening. Your help will help us to make sure that we can give the very best care to those that really need it. Thank you.